Hi, I'm Dr. Jocelyn Leveque, and I'm going to talk today about the difference between a facelift and a neck lift. So basically a facelift actually is lifting anywhere from the cheekbones down and includes the neck. We also have a mini facelift, which is only the face, and a neck lift is only the neck. So we have three options depending on what part of the face bothers you the most. So with a facelift, we are going to, like I said, lift the face and the neck. Usually we are doing this in two layers. We want to push the face back to where it once was when we were youthful and correct the problems that we see with aging. So we are going to correct the three problems that we tend to see, and that's going to be loss of volume in the face, typically here in the cheek area, also sometime in the folds area, and here in the jowling area. We're also going to replace the deep tissue back up where it once was because it has dropped with aging, with gravity, and we're going to trim the extra skin that occurs over time. So the first step is going to be to raise skin flaps, usually to a point that goes to about here in the neck. You go usually almost all the way to the midline. The second stage is going to be to lift the deep tissue, which in the face is a fatty fibrous area that is under the skin and on top of the muscles. And in the neck, it is a thin muscle that we find underneath the skin. So we take the lateral borders of those two areas and pull them back and secure them in a deep plane. And the last part will be then to redrape our extra skin in a upward, backward direction, trim the extra skin, and close. So a facelift and a neck lift can be done either in the office, which we do with local sedation. So basically we have you take a concoction of pills that will put you in a relaxed state. It will be a narcotic, something for anxiety and something for nausea, and that combination of medication will put you in a very relaxed state where you're not concerned about what's happening. And then of course we will inject you with local anesthetic so that you're totally numb during the entire procedure and you don't feel a thing. And most people just fall asleep and are very relaxed. And typically we actually probably do about 95% of our facelifts and neck lifts in the office because people are very comfortable with it. We don't have to be in the facility as long as you would at the hospital with your pre-time you have to be there and your post-operative recovery time. It's cheaper for the patient, so that is where we mostly do it. But if it bothers you to be awake for part of the procedure, we can definitely do your procedure in the operating room as well. In that arena, we can put you asleep. You will be done under general anesthesia and you wouldn't be aware of anything that's going on. So let's also talk about where the scar placement may be when you have a facelift. The good thing about these scars are they're very, very well hidden. For a full facelift where we include the face and the neck, we do start up here in the hairline where this scar would be hidden there. And then that scar is taken down. We go inside of the ear, around the lobe of the ear, and then back behind the ear and into the hairline. So all of those scars either lie within folds, behind the ear, inside the ear, in the hairline, but all very well hidden once they are healed. With the neck lift, the scar will be a little bit more limited than the facelift. We actually start at the lobe, go around the lobe of the ear, behind the ear, and into the hairline, since we were only lifting the neck. So who's a candidate for a facelift? There can be many candidates, and it is not age-based. The average time for a facelift is usually anyone starting in their 40s to 60s. That's the average time. We can do patients older than that. Most people younger than that probably don't need a facelift, but it's really individually based. Anyone who has loss of volume in their face with some excess skin and some relaxation to their face is a candidate for a facelift. We do obviously offer other more conservative, less invasive methods of facial rejuvenation. And anyone who may think they want more freshening up for their face should make a consult with us, and we will be happy to talk about all of the different options that we have to rejuvenate your face.